We're now going to look at a simple MCL taping of the knee. So a few key factors. You need to make sure that your patient or athlete has their knees slightly bent when we are applying. Have a think about the mechanism of injury and what you want to try and avoid. So valgus injury is the most common way they will injure their knee. So we want to be taping out. That means when we're applying our proximal to distal, we want to be pulling in a varus angle, and similarly when we come from here, we want to be pulling them up this way. All right, they're the things I want you to think about. For your anchors, I preferentially choose to use a 75mm stretch because we're not trying to stabilize the quad or the calf, and it allows the expansion and the muscle contraction. If you don't have access to the stretch, of course you can use your 38mm rigid anchors. Just make sure they are definitely in a bent position to ensure that you aren't going too tight when you go around. There are a few different things that you can add. Now sometimes if I'm using a 50mm stretch here, sometimes if I'm doing this, I will make sure I apply a stretch with what I refer to as a derotational strip first. So here's one of your anchors, and I'm going to go put down one of the other anchors. Now normally when I'm doing this, I'd be standing in a position where I can actually see the inside of the knee, but for the purpose of the video, so that you can actually see what I'm doing, I'm taping from the opposite side. So I wouldn't normally do that, all right? So a derotational strip can be done in rigid or it can be done in stretch. Now it's where I come down and I rotate into a varus position prior to starting the tape application. Now the reason why I might do that in stretch is so I can pull a bit tighter and not run the risk of causing a bit of excess compression. I would normally be standing to apply this tape as well, so I'm going to do that right now. Now typically you might see in textbooks that you have to do about 4 one direction, 4 the other direction, and 4 down, okay? As long as you apply these diagonal strips with a varus component to it, you shouldn't need the straight ones. So coming from proximal, traveling around, making sure there's that knee bend. Now I'm coming from here and applying that outward varus component to it. We want to fan about 3 to 4 when we are doing this, making sure you stay clear of the patella, because your athlete does need to bend, does need to run. So I'm going to do 4 at the moment, and as you can see, this is not an ideal position for me when I'm taping. I would normally be taping from that side. So now when I'm applying the other diagonal, I want to come from the other direction, because what I want to keep applying the strips in a varus direction. If I was to apply from here down, you can see I'm pulling them into valgus, which is the mechanism of injury, and we don't want to be doing that. All right, we do 3 to 4 this way, and then I'm going to show you again at the end what that big derotational strip is. So I can come from back around with rigid. I did it with stretch at the start. I can come on in and I can really rotate out and lock off. Now, a lot of the time I would get my athlete to check prior to doing the stretch over top that when they go in, they feel safe, okay? You can always add an extra strip. It's really hard to take off. Now with knee taping, you need to make sure you put stretch on at the end, wrapping around so all of it's covered. Otherwise, we run the risk of it ripping off very, very quickly. Now, that one I just ran out of, so I'm going to use another roll. Normally you would have enough that you wouldn't need to rip that tape off. Coming up, making sure, limited amount of creasing. Now, stretch tape doesn't stick to itself, so you're going to need to put some rigid strips on top to lock it off. Make sure it's there. Let them bend and straighten a few times to pre-stretch the tape, similar to when we do it with the shoulder. Good. Then, the other key factor. If you were on the footy field, it's highly unlikely you were going to stand them on a plinth when you were doing this. I'm in the clinic at the moment, so standing on a plinth, I put the plinth quite low, is fine. Normally what you'll have to do is have them on the ground with a knee bend, and you'll normally be kneeling beside them when you're taping. So if someone is up on the plinth, please make sure there's safety when they're getting off. The tape is quite tight, so it's a little bit restricted in bending. We don't want them falling off when they get off the bed.